As we come to work the fingers, we're going to work each finger in quite a lot of detail in turn. It doesn't matter whether you start with the little finger and work your way to the thumb. It doesn't matter if you start with the thumb and work your way to the little finger. You can even dot about. You don't have to do it in a logical order. I tend to do it in an order so that I know where I'm up to. But for the purpose of today, I'm going to start on the little finger and I'm going to work my way across to the thumb. Now, when we look at the finger, we're going to divide it effectively into quadrants that we're going to work. And I've drawn on Margaret's other hand so you can see where we're going to be working. You see on this little finger, there's pink lines and there's black lines. We're working on the black lines. We're not working on the pink lines. And that's just because we can access that connective tissue much more clearly from where the black lines are than we can the pink lines. If we're on the pink lines, really we're just pressing onto bone. But we want to avoid doing that. We want to be working the connective tissue. So we're working, if you like, at the side of the fingers rather than on the top of the fingers. We're not working right up and down and right at the side. We're working at an angle. This is all detailed in the book. So if you're not sure what I'm talking about here, you can look at it in the book and see it in more detail. And we'll also see it as I'm about to demonstrate it. It will become clearer as we work. So if I can take this hand back, thank you. Every time we work, we need to be careful not to put any pressure directly onto the nail bed. So we are going to start right at the very tip of the finger and we're working those lines that come down. Remember, we're not working at the side and on top, we're working kind of at angles. And we need to be putting pressure on all the way down. Now we can start off with some nice gentle pressure. You can work one individual line at a time. What I usually do is I will work 2 lines together. So you can see as I'm putting pressure on here, I'm avoiding the nail bed, although my finger underneath, the supporting finger, is also applying pressure and being careful not to put any pressure onto the nail bed. And all I'm doing is I'm pressing and I'm releasing. It's the bottom finger that's doing the work here. I'm pressing and I'm releasing so that all of the time I'm just aiming to free up that connective tissue. You'll see I start at the very tip of the finger. I'm working my way down. I'm pressing, I'm releasing. As I get to the knuckle, I'm jumping over the knuckle because we don't work on the back of joints or the front of joints. It can be very painful. I come down the tip of the finger, jump across till I'm on the middle bone of the finger, and then jump across again until I'm working at the bottom. Now, I will usually use my thumb for this, but for the purposes of the camera, I'm trying to keep my hand clear so that you can see what I'm doing. We need to work all 4 areas. So we're working the top side here, and then we're working underneath here and here. And we're always working up the body. We're working towards the heart. So from this side, you can see I can apply this pressure, work all the way up, skip over the joint and carry on working. I'm then going to come to the next line. You think there's 4 lines on the finger that we're working. Skip across the joint, move to the next line. Turn the hand over. I'm doing the same on the other side. And you can use either hand to do this. A little bit further on, I'll show you how you can use some massage tools to do this as well. So we've hit all 4 of the lines that we're talking about, the 2 on the bottom and the 2 on the top. Now you can get them together, so I can be pressing with my thumb and at the same time I can be using my finger to get pressure onto the line on Margaret's finger, always working upwards, always skipping over the nail. And we're going to repeat this for each of the fingers. Now the pinky is the hardest one to work on, obviously because it's the smallest one. But we mustn't miss it out because it's this finger that holds the tension that will come all the way up into the back of the shoulder. So it's important that we do give this the attention and the detail that's needed. You could work each finger for 2 or 3 minutes, or you can keep coming back to them. When something releases, the finger should feel nice and soft. It should be a little bit floppier than the other fingers. So once we've worked it, we move on, but we can come back. If I get later to work on Margaret's shoulder and there's something just won't move in her shoulder, I can again come back to this hand and I can do some more work there. After we've done the first finger, we move to the next finger. Now a little bit more give here because it's a bigger finger, so we can get a bit more traction. So you can see I'm putting the pressure on underneath, but I'm also starting to put a little bit of pressure on with my thumb. Again, being careful to avoid that nail bed. Jumping over the knuckle, moving up again and again, and you can see I'm working this outside line and this line underneath here. I can then swap my hand over and I just work the opposite side, so that now my thumb is doing the work underneath and my finger is just giving a counter pressure on the top, but in effect I'm working all of these 4 lines at the same time. Right up. Now you might have a big builder comes in and you look at the size of their hands and the thickness of the skin and think, I am never going to get through that skin, it's going to break my hands. And of course it's important to protect your own hands. There are various massage tools that you can use. These are 2 of the sticks that I use. This is a standard Thai massage stick. I can get in then underneath and I can roll. Be careful not to put any pressure on the joint. You can see I'm supporting the joint, but you can roll across that line and you'll find your depth increases, so practice it on yourself first. Flip over the joint and roll again, move over the joint and roll again. Then do the same thing on this underneath line here. You can see always I'm working towards the heart. I'm just using the stick to roll. Now I'm not going to use the stick on the top of the finger because there isn't as much padding here and I don't want to cause any unnecessary pain. So again, I'm coming back to using my hand here. The second stick that I have is a much finer stick, and you might find there's just something that won't move. I'm not going to use the very pointy bit, but a smaller stick actually gives you more depth. Now you will have your own massage tools that you're used to using, so just experiment and see how they work for you. But this can really be a hand saver for yourself as a practitioner, so that you're not putting too much pressure on your own hands. The other advantage of the stick is that you can treat yourself. You can roll your finger, you can roll the stick over your finger, you can feel those lines for yourself, and it's a good way to start practicing because you'll get a better gauge of depth as to what your client can take in terms of pressure. It's easy to go too deep with a stick. So you can actually work your own hands with this and give yourself a treatment just by rolling the stick over your finger yourself. Then we come to work on the thumb. The thumb is the same work as on the fingers, but we've only got 2 bones, so we have a bit less to work on. But of course the bone is thicker here. You also need to be careful because the thumbnail tends to be bigger than the other nails, so just take extra caution that you're not pressing the finger into the side of the nail bed. Now again, you could use your fingers here, or you could use the stick, whichever is your preference. Be careful if you're using the stick, especially with the thumb, to support the joint. You can see what happens if I just press here and I don't support the thumb joint. I'm pressing the thumb back too far. I'm putting pressure on that joint. So I'm supporting the finger just above the joint. Then when I put pressure on, it's not forcing the thumb backwards. Now we work all the way up the thumb, just as we did with the fingers, working each side of the hand, making sure we hit all 4 of those lines of connective tissue that are going through. Now remember, from the contraindications, there's an important point in here. If somebody's pregnant, we don't want to massage into this area. That's because that great eliminator point is in here and it's completely contraindicated for pregnancy. Now that's not to say you can still do general work over the top, you can still work the muscle underneath. We are talking about sustained pressure onto this point. So just be careful how you work, but don't panic if you've just rubbed over the area. You're not going to do any damage from that.